Reflux is a very common problem, and Dr. Vohra has a method that can really help stop that. Doctor, explain what you can do.
Reflux is basically when the acid from your stomach is refluxing into your esophagus or the food pipe. And that can manifest as heartburn, which is obviously the commonest presentation. So when somebody says they're having heartburn, it's essentially what they're feeling is the acid refluxing into their esophagus, and that presents as heartburn. Normally, there's a one-way valve which is supposed to be competent and prevent any significant acid from refluxing from the stomach into the esophagus. If the patient's valve or the lower esophageal sphincter is not competent or is lax, then acid will find its way and reflux back up. The more common reflux is when the patient is laying or sleeping at night, so it's nocturnal. And so they will wake up either with significant discomfort in the middle of the night, or they'll wake up in the morning with a feeling of a sour, bitter taste in their mouth, because that's really where the acid has been accumulating as they've been laying in a prone position.
I understand reflux is a real common problem. I know you have a procedure that can help stop that.
Traditionally, what patients do is they will keep a whole bottle of Tums by their bedside, and as they start feeling the symptoms, they will eat the Tums, and that'll make them symptomatically feel better. Now, with all the awareness, with the advertising, patients know what the purple pill is, and certainly they're going to ask their doctor that I have reflux, and the doctor will put them on the purple pill. These are basically medicines which will significantly decrease the production of acid in the stomach, and that's what gives them the symptomatic relief. The vast majority of patients are sort of undertreated or self-treated with reflux. And in this day and age, we have a lot of things to offer for the treatment of reflux. Now, we're not talking about the patient who has an occasional episode of heartburn. We're talking about the subset of patients who are dependent on the medications. So they get symptomatic relief, but they're been asked to take the medications for the rest of their life, or they're just going through these bottles of Tums on a regular weekly basis. For them, there's now a lot of interesting options which we can offer to eradicate the reflux.
And what do you do to help that?
We have endoscopic procedures, which is called esophax, which basically recreates the valve endoscopically and prevents acid from refluxing back into the esophagus, so the patient has no incisions or scars. In certain patients who have a very common condition called a hiatal hernia. A hiatal hernia essentially means that a portion of your stomach has now moved up into your chest. So in order to correct that, we're able to do this through a laparoscopic procedure. Essentially what we're doing is correcting their hiatal hernia, so bringing the stomach back where it belongs, and then creating a wrap or a new valve to prevent acid from refluxing back up. So essentially what we do is we use part of their stomach and wrap it around the lower part of their esophagus to prevent the acid from refluxing. It's a very effective procedure. It's done laparoscopically, so the patients have very little discomfort, are able to go back to work in a very short period of time, and it significantly decreases the amount of acid which is refluxing. If you feel that you're having symptoms on a more frequent basis, so if it is happening 2 to 3 times a week, or you have a dependency on the medications, then it is time to have a conversation and seek help beyond just the traditional medical therapy.